Good evening, interns, tutors, and pharmacists who are joining us this evening, and welcome to the last 2026 intern feedback workshop. So there are a few notices that we want you to keep with you as we are continuing with our workshop. And the first one is that please note that this session is scheduled for 3 hours, and we encouraging you to stay with us until the end so that you can get all the information firsthand. And we will have a short break of 15 minutes from 19 hours 30 to 19 hours 45. The time might be a little bit earlier or after, depending on how we are moving with our presentations. And please note that during the workshop, case studies will be discussed. So this workshop is more of giving you the knowledge on how to do your portfolio of evidence more than notes. So please make sure that you follow, and that will help you when you go back to be able to do the portfolio of evidence accordingly. And please note that you will be allowed to ask questions at the end of each case study. So the questions are also opened for tutors in case you need clarity, not only interns. So both interns and tutors must feel free to ask questions. And for you to ask questions, please make use of the Q&A function on Teams or the comment section if you are joining us on YouTube or Facebook. And please note that towards the end of the workshop, you will be requested to complete a survey. And this survey, we're using it as a proof of attendance. And please, if you can, also rate the workshop, because that is important for us to improve in future. And then lastly, the feedback presentation slides are already available on the website. So those the slides that are there, they're having more information than what we are going to provide you with tonight. Like I said, for this session, we will be doing examples of portfolio of evidence just to assist the interns to be able to interpret the assessor's comments correctly, and also to understand what is it that is expected of you. So for you to really make sense of what we are going to discuss today at your own time, we're encouraging you also to go through the feedback, because the feedback presentation slides that are there on the website, because the two are complementing each other. And with those few words, I just want to welcome you all, and hope you will enjoy this workshop this evening. And I'm going to hand over to my colleague to take us through the first presentation, and she will introduce herself. Thank you so much.
Good evening, everybody. Welcome to this session this evening. I just want to share my screen with you so that we can get the presentation started. Sorry about that. Sorry, my apologies. doesn't seem to want to share my screen. Okay, I think we have it now. Good evening, everyone, and welcome to the last presentation of the year. And I hope you find it very valuable so that we can assist you with the last portfolio of evidence submissions that you have to submit for the year. I hope you can see my screen. I just want to confirm that you can see my screen. So first of all, we're going to have a look at the overview. So why are we having this session for you guys? We're going to talk about the structure of the presentation, the case studies, the way forward, and then you can have some, we'll be able to ask questions as well. Sorry, Natalie, are you sharing? I'm not seeing the presentation at this stage. Sorry, Rianda, can you maybe just confirm, because I'm not seeing the presentation?
Yes, Adele, I can see your screen, but just put it in presenter mode.
Sorry about that. Is that clear now?
Yes, perfect.
Okay. Apologies, guys. So let's get straight into it. So first of all, why do we have this session? The structure, the case studies, and then my colleagues and I will talk about the way forward and we'll answer all your questions. So why we're having this session is all of you had the opportunity to submit your portfolio of evidence entries. You had the opportunity to get some feedback. You were either successful or not yet successful. You received some comments. So now you are familiar with the system, the format, you know about the competency standard, you've seen the behavioral statements. So it's now possible for you to ask your questions and to understand the comments and to give us some feedback to be able to be successful to write your pre-registration exam. So the structure, we're going to look at real portfolio of evidence submissions that was received, and we're going to discuss that with you, and you can follow on them and get some guidance on what might be wrong with your own submissions. It's linked to the previous workshop that's available on Pharmacy Council's website, and there's also an additional presentation for you available with some more information on the website. So please go and have a look at that. You have to take note that the examples that we are showing you are from interns as well as pharmacy students. So there might be a scope of practice that is for a pharmacy student, which is acceptable. So just keep that in mind. And then we also had to do additional confidentiality measures. We had to cover additional information because we are not allowed to show the intern. The intern was initially visible, or the student, but for confidentiality, we had to cover that as well. So please take note that there's additional confidentiality measures applied to this presentation, which you will not do in your own presentation. And please feel free to ask questions tonight. Tabang has already stated that. Please ask all your questions, engage with us. After each case study, we will take some questions and talk about that case study. So please ask all your questions that you have for us tonight. So I'm going to start with the first case study. And the first one, just quickly go back to the assessment criteria. As you guys know, this is available in the intern manual, page 35. You'll find this. And as we go through this, you will see that this is the exact marking grid that we as assessors and moderators use. So if you have this handy, if we read a learning title, quickly check what would you have given this learning title if you were the assessor or the moderator. So please make use of this and also evaluate your own submission before you submit to Council for Assessment. You can find that in your manual. And the first one we're going to have a look at is we decided to do 5.3 because this is a compulsory submission for all of you. We had a previous presentation. We did some of the activities there. And today we're going to do a few other ones for you to get some guidance. So what I'm going to do is I'm going to read the title for you guys. You can see learning how to implement ethical and legal practice in the pharmacy. And if you think about the competency standard, it's ethical and legal practice. So it's very close to the behavioral state, to the competency standard. So what the intern wrote in the reflection, they said, while working in the dispensary at XX Pharmacy, I encountered a Schedule 4 prescription and realized that I needed to better understand legislation surrounding ethical and legal practice in order to handle such prescriptions appropriately. I want to become comfortable and competent in dispensing and handling prescription medicine in an ethical and professional manner, and I need to familiarize myself with the responsibilities and expectations associated with working in the dispensary. So when you read this, you also have to keep the behavioral statements in mind, because remember we said that your title and your reflection should guide us towards what you want to achieve, and that is the behavioral statements. So what did the assessors say about this? First of all, the learning title is vague and not clearly aligned with the learning trigger, because this intern said learning how to implement ethical and legal practice. So that can be anything. Another comment, the learning title must be relevant to what you need to achieve in ethical and legal practice. It must be more specific to what you will be doing, because we actually do not know, except for the dispensing of a Schedule 4 that the intern mentioned, we don't know what they're going to do. It must be more specific. The learning title should not be a direct copy or similar to the competency standard or a behavioral statement. Going to the learning need of the reflection, competency standard 5.3 goes beyond dispensing as indicated by the behavioral statements. Remember, we said keep the behavioral statements in mind. And if you think about the behavioral statements of 5.3, it's applying the Pharmacy Act, the Medicines Act, and other applicable legislation, practicing within your scope of practice, recognizing your own limitations, keeping abreast of legislative changes and applying these relevant amendments, professional indemnity, and complying with code of conduct. And if you now think about the reflection, none of these behavioral statements were really clearly identified in that learning need. So we go further, you need to provide a very specific learning need. What aspect of dispensing a scheduled medicine specifically are you unfamiliar with, and what skills or knowledge do you hope to achieve after addressing the learning need that you have identified? Future learning need is quite vague, and it's not really related to the learning need or the competency standard. So you can see what the intern provided was very vague, it was non-descriptive, and it's not really linked to the behavioral statement. So when we go on to the planning, firstly, I plan to refer to the scope of practice for a pharmacy student. Remember, student submissions are also part of this. In the GPP guidelines, Chapter 3, Section 3.9, to confirm that dispensing Schedule 4 medicine falls within my scope of practice. I will also study Section 22A5 of the Medicines Related Substances Act 101 of 1965, along with the amended General Regulations of August 2017, to understand the legal requirements for dispensing S4 medicine. In addition, I will review Chapter 13 and 34 of the Pharmacy Act, the Act number, to familiarize myself with legislation regarding registration, to ensure I meet professional indemnity requirements, I will consult Chapter 3, Section 3.5 of the GPP. Finally, I will study Section 1.2 and 1.4 of the Code of Conduct for Pharmacists to ensure that I uphold ethical principles expected of me when handling Schedule 4 prescriptions. My goal is to dispense Schedule 4 medicine successfully. So now, what did the assessors say? So if you look at the grid, what would you have said to this pharmacy student? So the comments were, the planning is not met. What is the reasoning behind the use of the resources? Remember, you must mention the resource, the section in the resource, why you chose that resource, and link it to the behavioral statement for at least 75% of them. So how does it align with the behavioral statements to achieve at least 75%? Outdated legislation was used for scope of practice. Thus, the planning for B and C is not accepted. Because the intern mentioned old scope of practice, they are not keeping abreast. So B and C, therefore, is applicable. How do you plan to practice within your scope of practice is not mentioned. Which part of Section 22A do you intend to apply? Which regulation within the Medicines Act deals with the authenticity and validity of a prescription? What other regulations do you plan to use for the rest of the dispensing cycle? There's no planning for C, and that is keeping abreast of legislative changes and applying it, and cross-referencing to the behavioral statements is not part of the planning text. So you can see there was the students almost there, but there's a lot of things that should have been included in the planning. So the implementation. So I confirmed that dispensing S4 prescriptions falls under the direct supervision of pharmacist, falls within my scope of practice. After consulting the GPP guidelines, Chapter 3, Section 3.9, and it's linked to E, A and B, in line with the Pharmacy Act 53 of 1974, Chapter 2, registration, B, Chapter 3, Section 3.5, personal indemnity. I verified that I registered and hold a valid personal indemnity insurance, allowing me to legally dispense S4 prescriptions. After reviewing the Medicines and Related Substances Act 101 of 65, Section 22A5, that's evidence D, behavioral statement A and B, I gained a clear understanding of the legal requirements for dispensing S4 substances. I applied this knowledge to develop a prescription validity checklist, evidence E, so you can see the cross-link, and used it to assess a prescription received on 8/7/2025, which I deemed valid. Finally, I consulted the Code of Conduct for Pharmacists to ensure I conduct myself ethically during the dispensing process. So now we go on to the evidence, and you can see that there's a lot of evidence and there's some annotations. And even though it's not necessary to type your annotations, we do want to highlight or tell you how important it is that you provide neat, legible annotations. If the assessor cannot read what you have written, or they don't know why you have provided a specific piece of evidence, it's really difficult to assess your entry. So please make sure that however you provide your annotations, that it's neatly provided and that it makes sense of why you have included it or this piece of evidence. We also discussed in which order should you provide the evidence. So what really makes sense is if you provide your evidence, if it's possible, in the order of the behavioral statements to tell your story. There are some cross links, and you will provide more than one annotation if a piece of evidence links to more than one behavioral statement, but try to tell the story of what you did. And provide the evidence in that order. So you will see the student, in this case, provided the scope of practice of a pharmacist assistant post basic, and that is not valid anymore, as was mentioned in the comments. They provided the registration requirements of the Pharmacy Act. They've shown proof that they are registered with council, and they annotated it and linked it to the appropriate behavioral statement. They also showed that they are active on Pharmacy Council's website. You can see the evidence continues, where they are registered as a student, the registration certificate as a student. They have included their professional indemnity certificate, and they've included the section of the GPP that states that you should have professional indemnity insurance. They've included the Medicines and Related Substances Act. You can see in this annotation, there is an annotation, but it's not clear how the intern applied this. The legislation is here. It's linked to behavioral statements, but we haven't seen application for this. So there you can see there are the regulation for the validity of a prescription, how the student evaluated the prescription, and they linked it to the behavioral statements. There's the checklist that they created to evaluate the prescription. You can see the annotations and why it's linked. You can see honor and dignity of the profession, and they made an annotation of why they adhere to it. CPD, continuing professional development, also from the Code of Conduct, and an additional declaration that they have included. Also proof of submission on Pharmacy Council's website. And now we can look at the comments. So thinking about all the evidence and now looking at the comments. So let's see if you agree. It is linked to both the behavioral statements and 75% of the evidence. However, the description of the dispensing activity itself is vague. Only what is described, no how or why. No discussion as to how behavioral statement B, practicing under the supervision or with your scope of practice. It's not discussed. They just show the scope of practice. There's no indication that this activity was done under supervision. The interns show how they've applied the acts by linking the behavioral statement to the relevant acts. The evidence, A, is not met. The learning need is related to dispensing of a Schedule 4 item. Dispensing relates to 3 phases. You have only demonstrated how you completed part of phase 1. So we can only see the authenticity and the legality of a prescription. And the learning need was to be able to dispense, and that has 3 phases. There's no clinical review of the prescription phase 1, no evidence for phase 2, and no evidence for phase 3. Additionally, behavioral statement B is not met. It was an outdated scope of practice that was applied. There's no evidence that the activity was conducted under supervision of a pharmacist. Behavioral statement C, which is keeping abreast and applying legislation. They haven't adhered to that because of the old scope of practice, and they haven't included any current or updated legislation and how they've applied it. It says a recent amendment within 1 or 2 years was not applied. Amendment from 2017 is not considered recent. For behavioral statement D, that's the professional indemnity cover that was met. Certificate is valid at the time of the activity. The role as a student is noted and acceptable. For this activity, it was submitted by a student. For E, the code of conduct and how that was applied, this was then accepted. Even though 2 behavioral statements were accepted, you know there are 5. So the intern had to, or the student had to at least provide evidence for 4 of the 5 behavioral statements. The last phase, the evaluation. Following this learning activity, I gained a deeper understanding of the importance of ethical and legal practices when handling and dispensing Schedule 4 medicines. I recognize the necessity of working under supervision of a pharmacist to minimize the risk of errors. Rereading the Code of Conduct for Pharmacists reminded me of the professional principles I must uphold both within and outside of pharmacy practice. This learning experience strengthened my commitment to always follow relevant legislation and to practice within my defined scope. While working in the dispensary, I applied the knowledge I had acquired by using my prescription validity checklist to ensure that all Schedule 3 to 5 prescriptions were legal and valid. When I encountered non-compliant prescriptions, I confidently contacted the prescribers to have them corrected. Looking ahead, my next learning objective is to familiarize myself with the handling and safe management of psychotoxic drugs. So what did the assessors and moderators say? No specific example of applied learning. They only said they applied it on Schedule 3 to 5, so it's not specific. Provide examples of where the knowledge and skill acquired have been applied to a different activity. So how did they apply the legal and ethical knowledge that they gained in a new activity, not dispensing of other medication again? The evaluation lacks depth. Why was it important to handle and dispense medicine in a legal manner? How this learning has changed your practice is vaguely described. This learning experience strengthened my commitment to always follow relevant legislation and practice within my defined scope. And the future learning need is related to handling cytotoxic drug, which does not align with Domain 5. Your future learning need should align within the competency standard within the particular domain. So it should be something within Domain 5. Additionally, you need to address the following in your evaluation. Why was it important for you to complete this entry? What skill did you develop and how was it applied in practice? Provide a specific example of how you did this. How has it changed your practice and what do you still need to learn? Provide an example of a future learning need, and it should not be the same skill that you want to learn. Evaluation. Your evaluation should relate to the domain, ethical and legal practice. The skills relate to being ethical and follow regulations. Applying the regulations and code of conduct would be appropriate, and this should reflect in your whole evaluation. Your applied learning and future learning need example should also relate to this domain, but the future learning need should not be another application of legislation or a regulation in the scenario, as you have met this learning need with this submission. Your future learning need is another application of law or a regulation activity. It means that you have not met the learning need. And we do see that a lot with different activities. So the student might say, I was able to evaluate a prescription successfully, and now I want to learn how to evaluate a Schedule 3 prescription, for example. So it's a skill you've already mastered. So we want to know what other skill, what new skill do you want to learn? So that's all for me from Competency Standard 5.3. And we'll now take questions if there are any questions regarding this activity.
Thanks, Adele. Just a reminder to all those attending, if you would like to ask your questions and you're joining us on Microsoft Teams, please use the Q&A section on Teams. If you're joining us on YouTube, you're welcome to post your questions in the comment section and we will get to them. At the moment, I'm not seeing any questions. I'll let you know if we get anything.
Okay, so maybe I'll give 1 minute. If there's no questions, we can continue with Competency Standard 2.2. And I'm giving over to my colleague, Dr. Hubert, for this one.
Okay, good evening, everyone. My name is Dr. Hubert. I'm a moderator of portfolio of evidence activities. You are welcome to continue typing your questions and we will get to them at the end of this case study. So we are going to look at domain 2 and 2.2, which refer to patient counseling. So we can see there the title, Effective Patient Counseling on Metformin Therapy. Okay, so we can see, we want to see from the learning need that this student or this intern wanted to learn how to counsel patients using metformin. So while working in the dispensary, I observed a pharmacist providing comprehensive counseling to a patient on the use of amoxicillin. He clearly explained the importance of taking the medicine at prescribed times and completing the full course, even if symptoms improve. He also emphasized that poor adherence can lead to treatment failure and contribute to antibiotic resistance. This experience prompted me to reflect on my own counseling approach and highlighted a need to strengthen my knowledge and communication skills. Although I understand the pharmacology of many medicines, I recognize that I must improve my ability to convey key counseling points clearly and in a patient-friendly manner. I realize that effective counseling goes beyond giving instructions. It requires confirming understanding and promoting responsible medicine use. Developing this competency will enable me to educate patients effectively, improve adherence, and support safe, rational medicine use in my future practice. Okay, let's look at the comments from the assessors and moderators. So firstly, for the learning title, they said that the requirements are met because the title is original, descriptive, and related to the competency standard. The intern said counseling and metformin therapy, so it was clear. The learning need also indicated as requirement met because the learning need is clearly linked to patient counseling. The trigger scenario was provided to observe the pharmacist counseling a patient on amoxicillin is included. And the intern also explains what he or she hopes to achieve after addressing this learning need. So just take note that not all the case studies that we will presenting will be not successful or bad. It is to show you how you can improve your own submissions and what do we look for. Okay, so let's look at the planning. So I plan to develop, I'm just going to stop here for a moment. If we go through this, think about the assessment criteria as well while we go through it and what we want to see there. Okay, I plan to develop a structured counseling plan to familiarize myself with the key areas addressed during patient counseling, linked to behavioral statement D and B. I will assess the patient's understanding of their diagnosis and prescribed medicines through appropriate questioning and active listening, identifying knowledge gaps and concerns linked to A and C. To strengthen my clinical knowledge, I will review the standard treatment guidelines and SAMF 14th edition to better understand the condition and its treatment, referred to A and B or linked to A and B. I will prepare clear counseling points and visual aids to enhance patient comprehension, G and H. To clarify my responsibilities as an intern, I will review GPP section 3.9.1.4 and chapters 1.3, 2.7.1.3, and 2.8, reinforcing the importance of counseling and patient confidentiality. I will demonstrate correct medicine usage, explain side effects and precautions, ensure accurate dispensing labels, linked to G, and confirm understanding through structured questioning, behavioral statement I. So 2.2 is a lot of behavioral statements, so you will need to have really sufficient evidence to cover the 75%. So let's look at the comments. And this was marked as partially met. So the focus is more on the clinical aspects, but should also focus on soft skills. For example, listening, verbal and nonverbal communication, sensitivity to cultures, etc. If you look at the behavioral statements, you will see that there are specific behavioral statements that you need to address to show that you can listen active and reflective, that you can use verbal and nonverbal cues, that you are sensitive to different cultures. And the resources provided should be more specific. For example, which part or section of the standard treatment guidelines and SAMF will you review, or will you review the complete document? Okay, so the planning was not completely wrong, but there were still some aspects missing. Remember always that whichever competency standard you are busy with, that is about the skill and not the actual case or what you want to, the clinical aspect or the medicine. It's about, I want to learn to counsel. Okay, so let's look at the implementation. A newly diagnosed type 2 diabetic patient came with a metformin drip, evidence 1. I asked her to fill a pre-counseling form which showed limited understanding of diabetes, which indicated the need for counseling, behavioral statement A and evidence 2. He signed a confidentiality agreement, evidence 3. I read the SAMF standard treatment guidelines to enhance my knowledge of metformin, its role in diabetes management, dosing, and side effects, behavioral statement A and B, and evidence 4. I adjusted my counseling plan to address diabetes and metformin therapy, behavioral statement D, evidence 5. To enhance patient understanding, I used effective communication techniques, including active and reflective listening, and a pamphlet which emphasized the necessary lifestyle changes, behavioral statement C, E, G, and H, evidence 6. I counseled him in a private area to respect patient dignity and confidentiality, behavioral statement D, E, and F, evidence 7. The supervising pharmacist created a checklist to assess my counseling skills, linked to behavioral statement E and F, evidence 8. I put an appropriate dispensing label, behavioral statement E and H, evidence 9. I used the post-counseling questionnaire to confirm his understanding and address my concerns, behavioral statement I, evidence 10. Okay, so you can see there is a linking to the behavioral statements and there's also linking to the evidence. So now let's look at the evidence. So once again, the intern started with his or her scope of practice. Again, they used the outdated scope of practice. They used the Good Pharmacy Practice Manual, which is outdated still. Then maintaining confidentiality, they had again the Good Pharmacy Practice Manual, and then the importance of counseling patients also from the GPP. You can see here that here at the far right where they have the importance of counseling, it was linked to behavioral statement A and D. It is fine if you do this, if you link it like this, but this still does not show anything about your skill. It shows that you were able to get the resource, but not how you have applied it. And then it continues with the importance of counseling. And again, it's linked to B and C. And we have the patient's progress notes from the doctor. And here it is linked to behavioral statement A. And it does not really indicate the need that the patient have to receive counseling. So if you just provide this and link it to A, then it will not be sufficient to say that the patient requires counseling. As you can see, that the annotations are quite clearly labeled. Then we have the prescription from the doctor, where the intern looked at the prescription to see if it is according to legislation. We have the patient pre-counseling questionnaire, where the intern wanted to find out if the patient understand or know about her condition, and then also have ask the patient to sign a confidentiality agreement to say that the patient's name will not be made public. So you can see there's a lot of information, but we have not seen any actual counseling. Now we have the resource, and this is from the standard treatment guidelines. And here we have the SAMF. So again, it is linked to A and B, but this still does not show us How did they determine the need to provide counseling? Then there's a general counseling plan. It is important if you do this activity that you need to show who was the experienced colleague that helped you to formulate the plan, and not just providing the plan. And now we have the adjusted counseling plan. The only problem here is the intern had the plan, and now suddenly it's a typed adjusted counseling plan. Instead of using the plan and just with a pen right next to and how they adapted or changed or adjusted the counseling plan as they counseled the specific patient. Then we have an article of effective patient counseling. This still does not show that you can do it. It just shows that you can read an article and find information. And it's also important to show what information on this in this article that you use, and then how did you use that information. Here we can go on as here we have listening skills or techniques. And again, it's linked to the behavioral statements, but it needs to be clear how this was used. How did you apply these skills? Okay. And here we have the pamphlet that the intern showed and used to counsel the patient. Here we have 3 photos of the patient and the pharmacist intern, and they say here, I'm counseling this patient, and then a counseling checklist, and this was completed by the tutor. And then we have the medicine that was dispensed, and with the label, and the label was evaluated, and then the post-counseling checklist that the patient had to complete at the end of the session. Okay, so the comments that were made for the implementation, the description was requirement met. The description is clear and describes what, where, how, and when it was done. It also refers to the evidence items, evidence 1 to 10, and links the activities to the behavioral statements. One thing that was noticed that in the description, the intern referred to a male patient, he, and in the evidence, it is a female patient. So just make sure about that. How do the extracts from the SAMF and standard treatment guidelines determine the need for counseling, which was linked to behavioral statement A? There is also now clear evidence of how you have used effective communication techniques, such as active and reflective listening. So although the intern was successful for this submission, to further improve, one should consider adding evidence on softer skills. For example, listening effectively, using active and reflective listening techniques, provide eye contact, establishing rapport. So, and often interns ask, but how should I show that I can listen effective? And if you look at all those articles that's provided in the references, leaning forward towards the patient, making gestures, hand gestures, and not just sitting back and looking at the patient, but really making that eye contact, leaning forward towards the patient can also show that you are listening actively. You should also show how the pamphlet was used to support the counseling. And then history taking is also necessary to have a basic understanding of other diseases the patient has. We have seen that this patient have a long prescription with a lot of other medication. So it is important to understand the complexity of this patient's diseases and how they can also influence the adherence and will play a role in the way you counsel. Then, as I've said, outdated resource, the GPP for the scope of practice was used or was included in the evidence, and you should always use the most recent resource. And then the pharmacist interns practice, the scope of practice under supervision, and not that of a pharmacy technician. Okay. Then we look at the evaluation. So the intern wrote here, this deepened my understanding of diabetes and use of metformin, particularly the importance of explaining treatment in a way that is meaningful to a newly diagnosed patient. Through reviewing the evidence and counseling the patient, I realized that effective counseling is not only about medicine information, but also about listening, reassurance, and supporting patients as they adjust to a new diagnosis. I have since applied this learning by taking more time to assess patients' understanding, addressing their concerns, and adapting my counseling approach to suit individual needs. This has improved my confidence and helped me build better rapport with patients. As a result, my practice has become more patient centered and thoughtful, with more emphasis on clear communication, confidentiality, and adherence support. I've identified a further learning need to improve my time management during counseling and to continue developing my knowledge of chronic disease management and patient education. Okay, so here the comments or the evaluation was assessed as requirement met because the intern did say what was learned. They did say what the impact was on the way of practice. They did provide a future learning need, but they did not provide a specific example. So, although it's requirement met, the focus should be on the skills learned rather than the activity. And you need to give a specific example of how you have applied your learning in a new situation. In other words, give us an example of a different patient with a different disease or condition that you were able to counsel. Okay. And that is the end of this case study. So if there's any questions now, we will gladly answer. And if it's questions from Competence Standard 5.3, it is also welcome.
Thank you, Rianda. First question, will there be a recording of this session?
Okay, let me take it, Natalie. Thank you. So, remember this workshop is also available on YouTube. So the recording will be there on YouTube, and then on our website we will have the presentation slides. Thank you.
If I fix my CPD that I did on the 6th of March, meaning it also has a prescription that was processed on the 6th of March as part of the evidence, and resubmit them now, will the date still count as current?
Yes, Natalie, current is within the internship period, so it will be current, but the intern should just be careful depending on what the comments was. If it's something like patient confidentiality that they can correct or fix, then they can resubmit. Otherwise, they have to redo the activity, as I said, depending on what the comments were. But it is still current.
Am I expected to redo an activity if not mentioned specifically for patient counseling in case where comments were such as do not duplicate evidence and that evidence isn't sufficient?
Thank you, Natalie. Yes, if your evidence is not sufficient, then it is best to start over and start with a completely new submission. Because then, if you just want to fix it, you can step into the trap of fabricating evidence and adding evidence afterwards. So, if it is not only, if it's just, say, for example, patient confidentiality that was breached, you can fix that and it's fine. But whenever your evidence is insufficient, And it pertains to something like counseling, where you had to have the patient in front of you to get a patient signature, to ask for feedback, or whatever the case might be. Then rather start over and do a whole new activity than to try and fix it and add more evidence. Thank you.
Is it true? Oh, sorry. About competency standard 5.3. Is it true that the CPD must strictly pertain to control over Schedule 6 medication?
Natalie, I'll take that one for now. My colleagues can add. No, we always get Schedule 6, but everything you do in the pharmacy is based on legal and ethical principles. So you can cover anything that has a legal requirement, or you can add the legislation. So it's not only Schedule 6, it can be anything in the pharmacy that's based on legal and ethical principles.
For CPD 2.2, I provided article and document choices as evidence of how to communicate sensitively with patients and utilize verbal and non-verbal cues. However, the assessor stated reading these articles does not prove that you actually spoke with the patient in a sensitive manner or used non-verbal cues during the counseling session. What specific type of evidence is the assessor looking for?
Natalie, sorry, Rihanna,
Okay,
you can.
Adele, you can go.
Just to start, it's difficult to say if you don't see what the intern added, but sometimes interns include the article and they include a photograph of themselves, and then they say, I listened effectively. It's difficult to see from a photograph if you are able to listen effectively to a patient or that you are culturally sensitive. Maybe the patient could have verified that you were, in fact, that you listened, you had empathy, you answered all the questions, or maybe somebody witnessed the interaction that you can add that as evidence. But a photograph cannot really show us that you, or an article, that you have acquired the skill. So in that case, somebody might be able to verify that it is in fact true. I don't know, Rianda, if you can maybe add to that.
Yes, thank you, Adele. Yes, I think that your answer is correct, but interns should just be aware that they can't just provide, say, this is my tutor, or my tutor witnessed me, and then it's a tick box and they tick, and it must be really that true that the tutor observed the intern or whoever. It can be it doesn't need to be the tutor, it can be a pharmacist who's there and observing what the intern is doing, and then signing off there that the intern did this activity. We get a lot of cases where the intern put in a tick list that the tutor or the supervising pharmacist or the person witnessing is just ticking boxes, and then the name and the surname and the P number and everything of that person is just typed out at the bottom, or there's a stamp, and there's no handwritten signature or declaration that this actually took place. So yes, but Adele, I think you've answered sufficiently.
Yeah, Rianda, I just want to add to that. You have to make sure that you not only the checklist, not only the photographs, not only the article, but you have to provide a combination of everything. In the photographs, we can maybe see your body language. Somebody can verify other skills. So you cannot have just the tick list. We want the photographs and we want the article and we want the verification. So some skills you can see on an open body language, hand gestures, you using the pamphlet, that you can show us in a photograph. So we need all of those to be successful in this activity.
When an assessor returns your CPD and says that your write-up is overly summarized, what should you do considering that we're limited to 1,000 characters?
Okay, thanks, Natalie. I'll start off with this one. Usually what is meant with overly summarized is that you don't give sufficient detail on what happened on the trigger or on the planning. And as you could have seen, though, these examples that we have used thus far, we did not edit except for removing the names of the hospital or the pharmacy and replacing that with XXX. Otherwise, we did not edit anything there, and they were all complete in a way, except there where we said that there can be more specifics to the resources, etc. So usually over summarized means that the intern should provide more detail, and often interns put in unnecessary detail where they and then omit information that is important. So yes, 1,000 characters is limited, but it is sufficient space to provide a thorough um, uh, description of what you want to state there. If you stick to with the learning need, the trigger scenario, your learning need, what you hope to achieve, then you can fit that in 1,000 characters. But often it gets fluffy and you start to, and as an intern, I'm responsible for this and this, or as a pharmacist, it is my duty to. So, and then it can become over summarized because then the crux of the matter is not highlighted enough. So that's one way of dealing with that. I don't know if any of my colleagues want to add something.
Yes, Rianda,
Yeah,
I agree.
okay.
Sorry, Makadi, you go.
Yeah, like Arianda said, normally we hear the issue of characters, but in real terms, is about maybe putting information that is not really relevant or necessary. But otherwise, if you stick to the BS, and then it will fit. And then because what we are looking for here is if you are meeting the BS and you meet all the criteria for assessment, not really many other things that we normally see in the evidence provided. Thank you.
All right, I collected my evidence in February. Will it be accepted if I submit it now? I just need to do the write-up.
Yes, Natalie, it's still within the internship period, so it's still valid.
Does attending a webinar on a specific health topic count as keeping abreast with current legislature, or it specifically has to be applying the most recent amendment of the Act?
If the webinar was about a change in legislation and they give proof of the webinar, they give the legislation and show how they applied it, that would be acceptable. But that depends on what the webinar was about, because this is specifically changes in legislation that has to be applied.
For competency standard 4.6, will it be acceptable to have two triggers for behavioral statement A and B?
Thank you, Natalie. Yes, that would be acceptable because often you will struggle to be able to address or to show application of a policy and an SOP that is covering the same trigger. So yes, it will be fine. It will be accepted.
If the only fault of my evidence was that it wasn't clear if I had direct pharmacist supervision, am I just supposed to circle where the pharmacist's signature was?
Yeah, it's difficult to answer. If that was the only comment, then that might be acceptable, but I don't think that might be the only issue because the verification is done online. Yeah, maybe my colleagues can add to that.
Yeah, okay. Yeah, definitely. The So there could be other comments as well, but that one can be corrected. Like it depends on what the comments are, like a colleague said. But in most cases, there may be other comments that may also need to be addressed. But if it's only that one, then the intern can be able to point where the corrected, and then they can resubmit. It's like in a similar manner, like the confidentiality, where they will say this one was breach of confidentiality, then they can go back and maybe edit, then it can come back.
I would just also want to add, I'm not sure, maybe this one specifically referred to the intern that some interns do, if they do 3.5 or 3.4, where they either do compounding or dispensing of a prescription, then for the compounding, every step should be signed off by the pharmacist, because the pharmacist should do it under the direct supervision of the pharmacist. Then you will have to redo it if the pharmacist didn't sign. You can't go afterwards and add the signatures. The same with the phases of dispensing. That's the only ones that I can think at the top of my head now, that the pharmacist should specifically be there and direct supervise, for direct supervision, where they have to check every step or have to check the certain aspects of the dispensing process. But then I would say you have to start over. But if it is something else, then I guess what Makadu said and what Adele said is correct. Thank you.
How do we show the professional who helped us put the planning together?
For this one, I mean, if you have to work out a plan, a training plan or whatever, usually it's a bit of a back and a forth. You will start with ideas, your tutor will give input, and show us that. Show us, this is the plan. Here we had a discussion. This was the comments that was made by my tutor. This is how we fixed it, and this is my final plan, and my tutor signed off on it. So just that little bit of interaction um, between you and your tutor, and how you amended your training plan. I think that would be sufficient.
If I am left with one CPD that has been returned by the assessor, but others are successful, I already booked the exam. When is the deadline for resubmission to ensure exam isn't affected?
Okay, thank you, Nat. Let me take this one. So what is happening is, in the intern, if they have registered in January, it means they have met the requirement to sit for the examination, because they have already submitted 6 entries and they are successful in 5. So they just have to resubmit the entry that was assessed not yet successful. Anytime, I mean, they can submit now or they can submit later. That will not disturb them from sitting for the August examination. So the next submission deadline is on the 29th of June 2026. So which is next week, Monday, if I'm not mistaken. Yes, that's how I can answer, but that is not going to affect them in any way in as far as booking of the examination is concerned. Thank you.
Is it all the behavioral statements or 75%? Because in the report, I was told to complete all 3.4 behavioral statements.
No, if it's four or more, then it is 75% of the behavioral statements. If it is 3 or less, then it is 100%. But again, it depends on the competency standard that was selected. I assume this one was for 3.4, and it also depends on which of the phases it was, and perhaps the evidence was not sufficient to address the behavioral statements that the intern thought or linked to that evidence. But yes, it's only 75%. Thank you, Nat.
Last question for this section. When the assessor says your approach for 5.3 is broad and you must narrow it down and focus on one thing like Schedule 6 only, not other pharmacy-related stuff like prescription interventions.
Thank you, Natalie. This is also a difficult one because it's difficult to comment on something that you have not read. So I don't know what this intern wrote for 5.3. Probably it can probably be the trigger scenario or the trigger scenario that was broad, or the learning need that is not specific enough. But usually we say that you should not only focus on Schedule 6, but that you should focus on ethical and legal practice. But often interns, specifically for 5.3, start off with, as a pharmacist intern, I'm the custodian of medicine, and it's a very fluffy thing about legal and ethical things, and they don't get to the point to what actually triggered them to know that I need to know how to practice ethical and legal, fraudulent prescription, or patients requesting still pain tablets, or whatever the case may be. So, yeah, I don't know if Adele or Mr. McCarty wants to add.
Yeah, thank you. I think in some cases is when it is not very clear on what they intend to do or want to do. I'll give an example of maybe I think it's supply chain, where you will hear interns talking about supply chain, which is very, very broad because it involves ordering, receiving, whatever. But now, but reading further on their document, you see that they are maybe looking for one particular area. And then the question is going to be, now that from the beginning they spoke about supply chain, applying supply chain principles, we're expecting to see them covering all those kind of information because it is broad. So in that case, we may write that what they want to cover is very broad. So sometimes they need to be very specific so that they can focus on one particular issue that we can follow from the beginning till the end, unlike having so many things where you don't know which one is which. Thank you. Thank you, colleagues. My name is Muratezi Makado. I am the assessor, and I will be taking you through on domain number 6.2. The title reads as follows: providing education and training on hand hygiene to a particular hospital pharmacy staff. Right. What the intern wrote is that I was instructed by my supervisor to train pharmacy staff on the importance of hand hygiene and washing techniques for infection prevention control. I recognize the need to improve my ability to educate and train effectively within a professional setting, as I have limited experience in structuring and delivering educational sessions to people. This highlighted the necessity for me to develop stronger communication, presentation, and teaching skills to ensure that the information I share is engaging, clear, and impactful. Enhancing these skills is essential as a future pharmacist, as I may be required to train staff, interns, or even patients. By addressing this need, I aim to gain confidence in facilitating discussions, organizing content effectively, and responding to questions with clarity. My goal is to become a proficient educator capable of delivering structured, engaging, and informative training sessions that contribute to a more knowledgeable and efficient pharmacy team. Like a colleague said, yes, we do not only give you examples of those ones that were not crafted well, but there are those ones that are also where you can also learn the good things. Let's see at the assessor moderator comments for this one. The overall comment is a requirement met. Why? An authentic learning trigger has been described, as you have heard in the previous slide, and the learning need and intended outcome are clearly stated through the. However, we always indicate that although the requirements are met, we can also give some information, additional information, like is the case in this particular one. The comment was to provide more background on what prompted the supervisor to identify this as a training need in the family, because we only get the story from the supervisor, but that is what another comment saying. It will help if maybe they provided more background on what prompted the supervisor to identify this need. Other comment is to keep the focus on the skills. I think this is a general comment that we always emphasize. The skills required to provide education and training rather than on the subject. So remember here, the focus is on the skills. And then, we can move on to the next one. So in terms of planning, maybe let's first read what the statements are, and then we can try to reach or take you through on the assessor comment. It reads as follows: I will get guidance from an experienced pharmacist on structuring a training plan, including the time frame and key learning objectives, which is linked to 6.2a. So this CPD is having 3 BS, so the statement is already touching about the BS number A. I will create a PowerPoint presentation using the WHO guidelines on hand hygiene in healthcare, which is for 2009, and Center for Disease Control articles, which highlight the role of hand hygiene to reduce infection. While I'm still here reading, the WHO, they gave the reference. It is 2009 document. The Center for Disease Control, nothing has been mentioned about the reference anyway. And then they continued to say also good pharmacy practice guidelines, which highlights the importance of hygiene standards. Here they reference to the pages number 38, 83, and 162. And the hospital infection prevention control policies, that's developing my learning 6.2C. By self-assessment, I will identify and outline my learning goal, action plan, strengths, weaknesses, and strategies to overcome them. This statement was made to link to 6.2b. I will also assess the staff understanding through a question and answer session, and have them repeat the hand wash process, which is again linked to 6.6c, and develops forms to gather feedback for my own training assessment. I'll notify the staff that the session will be scheduled for 25 March to 2025 at the pharmacy. Right. After that statement, the comment from the assessor moderator, again, the requirement met. I think you have seen the linking of A, B, and C. The planning is linked to the behavior statements, and sufficient resources to develop the training materials have been consulted. I think in the statement they did mention about some page numbers, chapters, and so forth. However, I think that it was not for all reference used. Other comments is they need to state every resource in full. So meaning that we need information about the title, the chapter, the section, page numbers. If you remember, I think when I was reading the statement, the CDC articles, I think, did not have this information. That is why this statement is coming to say, yes, as much as some of the references are there, but it will have been good if all them, it was made for all these ones. Okay, yeah, like it's indicating that some are incomplete or maybe not even there. Clarify how you will self-assess your knowledge or skills. Yes, the information given is just that self-assessment will be made, but no information was given on how it will be done. That is why now this comment is coming to say maybe intern need to clarify how they will self-assess, which it can be done in many cases. Some can develop a checklist, some can develop a question. I think that is what we wanted to hear more as well. As much as you're going to do the self-assessment, how are you going to do that? And we should see that under planning. So that when you get to the implementation is something that you have spoken about under planning. And then lastly, and consider adding resources specifically on how to conduct effective training and on communication. I think the issue of the training plan, whatever way it was mentioned and linked to 6.2a, again, I think there was not enough reference to link to that. Okay, now let's move on to implementation. It reads as follows. I outlined my learning goals, strengths and weaknesses, and identified strategies to improve my training skills. That is evidence 6.2b. I compiled a training plan with guidance from an experienced pharmacist where we discussed the training time frame, 30 minutes, key objective, and structure of the session. So that information links to 6.2a, which is all about development of a training plan. Okay, staff were notified about the training. I created a PowerPoint using various resources. I printed my PowerPoint presentation covering hand hygiene techniques, contamination risk, and infection prevention strategies. That has been made to link to 6.2a and c, which I used on 25 March 2025 and conducted the training at a hospital pharmacy. Right? It's made to link to the BSA and BSB. Remember, BSA is about training plan. BSB is about self-assessment. I demonstrated the hand washing technique, made staff demonstrate it, and I held a question and answer session to assess staff understanding, which is linked to BSA and C. The staff were asked to sign a register for attendance and fill an evaluation form to assess my performance. I then evaluated my own performance, which links to BS number B. Now, when we come to the evidence, remember under evidence, this particular one is having 3 BS, meaning that 100% of the BS need to be covered. Like a colleague said, that only when you have 4, then at least you can meet 3 out of 4, which is 75. In this case, there are only 3. Right, let's look at evidence number 1. Evidence number 1 is about conducting or performing self-assessment, which is the assessment that the intern needs to perform to assess his or her knowledge about the topic that they want to present. Is not the self-assessment for the participants. So the evidence has been given there, and it is well annotated, as you can see. So meaning that up to the stage when we are looking at evidence number 1, then BS number B is satisfied. You go to evidence number 2, which is all about the training plan. Remember, BSA, development of the training plan, working together with the supervisor. So the training plan has been given under evidence number 2. As you go through all this evidence, then you can see that the effort has been made to make sure that the BS are met. I think as we move down to, maybe let's we move down to the next one. Yes, they are showing how they've done it, as it's all about training people on the washing hygiene and everything. That is what they are showing it. But at this point of time, we still need to get information about BS number C, because A, B, and A are already covered. So as we move down to the next evidence, this is when now you start seeing the intern showing or showcasing the information about engagement with the staff members, participating, asking them questions, as you can see, evidence number 11, and even the one to follow, where there are pictures, maybe pictures about the staff in an answer and question session. When you look at the annotation, this is where they will be indicating that this is the time when they were engaging, staff members were asking questions about the topic to be presented, which addresses BS number C. And even in the annotation, it is well indicated that this kind of engagement links to BS number C, meaning that BS A, BS B, BS number C is met. And also, maybe if you look at evidence number 12, it is, here, we'll always tell you that when you submit evidence like the register, in some cases, we see registers, yes, with many lines, but the handwriting the same. So you see, whatever you give it as your evidence, it need to be authentic. I think in this case, the signatures are different. So okay, now let's look at the assessor moderator comments about what has been provided. Again, the requirements met. Why? The activities are logically explained and address all 3 BS. In this one, you don't have to struggle looking for where to get the evidence. I think they are structurally, well documented. You see the training plan nicely presented and nicely linked to the PS, like all other. That is why the comment is saying they are logically explained and addresses all the 3 BS. Okay, the intern is advised to indicate clearly where the training was held and who attended, and consider including more detail on the training. Probably maybe on the register, they can indicate the venue where the participants, and then including more details on the training skills applied, as we always emphasize on that. How the information was presented and the communication and so forth. Okay, now on the evidence, the annotation correctly links each piece of evidence to the relevant BS. I think we have seen that. I've explained that as well. That is why the outcome is requirements met. And the evidence speaks to all 3 statements. I think, colleagues, you'll agree with me on this one. The self-assessment should focus on what was identified and planned before the activity, move outcomes and reflection to the evaluation. So this is just an advice. The tutor verification shown is a screenshot of a previous verification and is not acceptable. The verification should carry the date, facility stamp, signature, name, and PIN number of the supervising pharmacist. The attendance register is of concern. Okay, I think I've spoken about this. Similar handwriting and signatures. And then down the images of genuine engagement with the audience. Yeah, so in this case, the handwriting on the register looks like it's one handwriting, but at the same time, the engagement and the pictures that have been also displayed, they are now showing that, yes, indeed, the training took place. So I think in the question session, we also did allude that sometimes we need a combination of this in order to provide the evidence. I think this is one typical example. Additional resources could have been included, specifically pertaining to how one can conduct. This comment also appeared under training under planning, because in planning, a comment was not much information about the resource was provided. So it's a continuation also in here. Now on the evaluation, as we are on the evaluation, I think it's good to remember that here, what is needed is more of what have you learned? How did you apply these new skills? How did it influence your way of working, and what is your future learning outcomes? Let's see. Through this experience, I developed the skill of training colleagues effectively, which was previously unfamiliar to me. I learned the importance of structuring a training session, managing time efficiently, and using clear communication techniques to ensure engagement. By adapting my approach to match my audience needs, I improved my ability to simplify complex information and present it in a concise, understandable manner. Since this session, I have applied my training skills when educating staff on the proper reconstitution and administration of powered antibiotics, ensuring they follow correct dilution techniques to maintain drug efficacy. I believe this experience has strengthened my confidence in educating healthcare professionals. Moving forward, I aim to refine my training techniques further, incorporating interactive learning methods to improve knowledge retention and engagement in future sessions. Lastly, on the comment from the assessor moderator, again, requirements met. You have reflected on what you learned about providing education training, and provided a clear, practical example of applying the scale to a different scenario. However, Intern has been advised to elaborate on the impact on their practice rather than simple stating that the confidence has been strengthened and identify a future learning need that is genuinely different from this activity while remaining within the domain. I thank you.
Okay, we have a couple of questions. If my CPD was returned 2 times, is there a way of contacting the assessor to seek clarity on what's really needed? Because when I address the comments, it comes back with new comments.
Thank you, Yes. So what is happening is there is a criteria for interns to have a consultation with an assessor. What is happening is interns, when they're submitting their entry for the first time and it comes back unsuccessful, we expect them to discuss the assessor or assessment comments with their tutors and make a resubmission. And if it comes back unsuccessful after the second attempt, then they can request to have a consultation with the assessor. So that information is provided in the intern and tutor manual, page 43. I think it's under section K. So interns must just go and familiarize themselves with that criteria, but they do qualify. So what they need to do then is to submit a request to the office via the CPD query and to request a consultation with the assessor. And in this case, we really requesting Intern to provide more information on what is it that they need assistance with, because sometimes you may find that the assessors are not available to have a meeting at that time, but they can guide them via email. So as long as they have provided enough information, then they will receive assistance. This is important because they don't really have to wait long for assessors, and you find that they even miss the submission deadlines. So yeah, thank you.
During a resubmission, do I leave the evidence that was already submitted and just load the new evidence, or do I delete the first evidence that was not successful and replace it with the new evidence?
Thank you, Natalie. It is always best to remove the evidence that was not successful so that there's only one document. There is a date, so we can see when the evidence was uploaded. And usually if it's a resubmission, we start from scratch assessing, because interns need to start with a new activity, unless it was patient confidentiality. So we look at the newest, most recently uploaded evidence. So it's best to delete and only put in the new complete evidence. Thank you.
Where on the SAPC website can I find this presentation?
Okay, thank you, Natalie. So the intern, they must log into the website and they go under registered persons, and then they select interns, and then they go to portfolio. Then under portfolio, there are a number of presentations, and this one we are also going to upload it there, including the ones for the workshops we had from February. They are already there. So that's where they will find this presentation slides. Thank you.
Do we have to give specific references in the planning text, for example, page numbers, etc., if it has been annotated in the evidence and mentioned in the implementation?
Yeah, I think according to the criteria, if they can go back the criteria, it is very clear that for intern to get full marks, they need to meet certain criteria. One of them is the BS meeting. I mean, meeting BS 100% of them, and also providing specific resources. Yes, as much as it may be available under implementation, but it is also one of the criteria under the planning.
Thank you, Mr. Makoro. I would also just like to add, in the planning, you plan where you're going to look for certain information. That is why we say the page numbers or the section numbers is important in the planning, because that is also what we will then look for in the evidence. So whatever you put in your planning, the resources, we want to see it in your evidence, and then also the specific page number. So yes, you need to add it there. Thank you.
About competency 6.2, can a declaration from the pharmacist attesting the discussion about holding a particular training session and for when it was scheduled solely be submitted as a training plan to meet behavioral statement A? Our questionnaire is filled by the participants enough to satisfy behavioral statement C.
Okay. What 6.2A is looking for is the training plan. So whatever the evidence that is needed there, it is to prove that the training plan has been developed, of course, in consultation of the pharmacist or the manager. And then for BS number C, okay, after conducting the training, you need to assess if the participants did understand what they've been training on. And in this case, there are various ways of providing evidence. It could probably be through the questionnaire when you give them a multiple choice questions. Then in some cases, interns do submit the outcome or assessment after they've submitted to indicate that, yes, indeed, this is what they've done. Then it becomes part of the BS number C. Other information that is not, because we need to get information that we can. Remember, we are not there when they are performing these activities. So whatever information that they are submitting, whether it's for A, for B, or C, it should be sufficient to satisfy the BS.
Natalie, I would just like to add, the training plan needs to show us information on when will this happen, where will it happen, what will be the objectives of the training, how are you going to conduct the training. So it should be an outline of a clear plan of what you will be doing and what you will be covering. So you can add the declaration, but provide the plan as well. What you thought of you want to put in your training session. Thank you.
Can I do a poster for domain 6.2 if I want to teach my colleagues about a certain disease outbreak instead of a PowerPoint presentation?
Natalie, I'll start with that one. Yes, they can make a poster. They can just show us how they used the poster. We want to see what information was there. Did they understand the information? But you can use any means of education. You can make a pamphlet, a poster, a PowerPoint. It can be a demonstration. You can do it in any way, as long as it's the information provided is clear.
My report's comments on a secondary submission stayed exactly the same, although I have addressed it. Only the date of one of the comments had changed. What do you suggest I do?
Okay, thank you. Next, let me take this one. So, sometimes when the intern hasn't made the changes um that were indicated in as part of the assessment comments, the comments will remain the same. Sometimes assessors they don't update them. But in this case, I will request the intern to send their PIN number so that we can just check and confirm if that is the case. Yeah, because there were instances wherein there was a glitch, which IT helped us to resolve. So yeah, let the intern submit the PIN number and then we will check. Tomorrow we'll advise accordingly. Thank you.
One last question before we take a break. What kind of evidence can you submit to show that you asked for a patient's medical history and what medication they're currently taking?
Thank you, Natalie. So in this case, you can compile a patient assessment sheet where you record while you are talking to the patient their age, their gender, do they smoke, do they drink alcohol, do they take any other medicine. You can confirm that medicine with the patient's history on the dispensing program. You can ask about diseases that they have, if they have any chronic diseases, if they are taking any supplements. So, so yes, that would be the best way to do it, is to compile a patient assessment sheet while you are busy talking to the patient and not typing it afterwards or typing out the conversation that you had. But while you are busy, I mean, you will get a trigger scenario that you don't know how to counsel, or you don't know how to do pharmacist initiated therapy, or you don't know how to dispense a prescription, or there was some issue that you had. And in your planning step, in your planning phase, you then say you are going to compile a patient assessment sheet that will help you um, to gather the relevant patient history and medication history, and then you complete it while you are busy with your counseling or consultation or whatever the case might be. Thank you.
Okay, thank you so much. I think we have attended to all the questions that were submitted, and then now we're going to take a 15 minutes break. Please let's come back at yeah at 8 o'clock so that we can continue with the remaining case studies. Thank you.
Welcome back, everyone. I hope you had a well-deserved break, and we are continuing with Competency Standard 4.6, which is policy development. And you can read on the left-hand side what is the goal of a policy. You can have a look at that, but we're going to get straight into this competency standard for you to have a look. So first of all, the title, learning how to accurately apply policies at all times, which are relevant to any current practice. And then in the reflection side, it says, describe the learning need that you have identified to improve your knowledge and skill and what you have to achieve. So what the intern wrote is a gentleman came in the pharmacy to deliver a couple of boxes from DSV for the ready-made parcels pickup from CCMDD parcels, and he asked to sign for him since I was the only one free at the moment, and he said he'll help me since I was clueless. I needed to learn how to accurately apply and adhere to SOPs and policies of the dispensary, especially on stock management. Since I have realized there is a knowledge gap on me, I hope to be more familiar with the steps to be followed when dealing with guardians or partners who are collecting on someone's behalf and what happens to the uncollected parcels. I hope to familiarize myself with SOPs and policies so I can at any time put the needs and rights of patients first and conduct myself in a professional manner and avoid misconduct. The learning title, Learning on How to Accurately Apply Policies, which are relevant to current practice. So there you can see the intern provided a learning need, but it covers more than one activity. So let's see what the assessor and moderator said about this. So for the reflection, it's the requirement was not met. The title is vague and general and does not describe activity that the intern intends to learn or undertake. It should not be a near copy of the competency standard. About the learning trigger, the trigger, what you intend to learn and what you hope to achieve are not aligned. The trigger concerns receiving CCMDD parcels and what to do when someone other than the patient collects. Yet the stated learning need shifts to applying SOPs and policies on dispensary stock management. So the comment there was clarify the specific knowledge gap and identify the specific policy and SOP relevant to this activity, so that the title, the trigger, and the learning need and the intended outcome form one coherent reflection. So the intern needs to decide exactly what the learning need was and what they intend to do in this activity. So when we go to the planning, I plan to visit the dispensary SOPs, especially stock policies, with the help of my colleagues who are more familiar with them than I. I will include information on policies, SOPs. I plan to participate in other areas and roles in the dispensary so I can improve my knowledge. I plan to make my own notes so that I can learn the managing of stock on my spare time. I did all this in order for me to be able to handle or manage the receiving of stock from the driver or delivered stock. I plan to do some work shadowing of the pharmacist learner basic during their management of stock tasks. I plan to visit the dispensary SOPs on delivery of stock. So when you think about this, all the activities we've spoken before and what should be in the planning, you should quickly think, what do you think about the planning before we go on to what the assessor and the moderator said about this. So you can see there's limited details. We don't know which policy, which SOP. So let's have a look. It's partially met, state the specific resources. So consult with full details and refer to the specific policy, the specific SOP relevant to this activity, rather than mentioning the behavioral statements just in passing. Link the planning element to the behavioral statement, applying policies and applying SOPs, A and B, and show how it addresses the identified learning gap. Distinguish clearly between a policy and a SOP. Write the plan consistently in future tense and confirm that the chosen resources cover the activity. For example, whether this is about the dispensary SOP on delivering of stock and stock management policies, or is it in fact applying to the receiving of a CCMDD parcel or to someone collecting on a patient's behalf. So you can see there is no clear planning or a clear learning need. Implementation, I consulted the CCMDD SOP for guidance on receiving stock in the system and dispensing it to the patient. I managed to capture a couple of invoices for the stock received. I consulted the stock SOP for capturing stock and ordering stock and managed to perform both tasks on my own. I consulted the cold chain management SOP on how to receive, store, and dispense it. On the 15th of January 2025, I received training from my colleagues in the pharmacy on how to capture stock on the system using the streamlined receiving SOP. I received the guidelines and policies of the management and conduct of a pharmacy. So that was our implementation. And now we get to the evidence. So from the implementation, it's still not really clear what this was about, what was done, what was the actual activity. And you can see there's a Department of Health document that's there with a signature of the tutor. It says at the bottom, registration of patients on the CCMDD program. Then we have receiving from a government gazette. You can see there are some annotations, but they are not very clear. So it's not really clear why this is relevant to this activity. We have a SOP also from the Department of Health. And you can see the intern talks about a pharmacy. So these are still not really clear on how they align with the behavioral statements. And you can see these are only guidance documents, so we still don't see any implementation. The next thing, we still have the continuation of a Department of Health document, and we have a CCMDD annexure for a health facility for a patient that receives these products, but it's not filled in, it's not signed. So let's go on and see what else there was. And there you can see that was the only evidence that was submitted for this activity, and you do not see the application of a SOP or a policy. So the implementation comments that the requirements were not met. The implementation describes several unrelated SOPs. Remember, there was cold chain and things like that, without aligning them to the behavioral statements or to annotate the annotated evidence, and it is inconsistent with the reflection. The reflection concerns an already dispensed CCMDD parcel collected by another person, where the implementation describes receiving CCMDD stock and capturing the invoices. Because the learning need and the knowledge gap were not clearly defined, the activity is not linked to a single coherent outcome. The evidence is not sufficient and should be annotated clearly. And you can clearly see when thinking about the evidence, you don't see how the intern learned the skill and how they applied the skill by applying the SOP and the policy. So the next for behavioral statement A, applying policies, there is no policy from your own work setting in the evidence, no evidence that the policy was applied. Board Notice 49 of 2015, the minimum standards for thermolabile products is not a policy of your pharmacy and is not related to CCMDD. For behavioral statement B, include the complete SOP and the evidence that you applied it. The 4 pages submitted from the 12-page DOH CCMDD SOP deal with enrolling a patient and do not correspond to the activities that you've described. Select one clear activity, refer to a specific policy and a specific SOP that govern it, annotate the evidence, and demonstrate actual application of each. A new entry must be submitted. So you can see we need a policy and show how it was applied, and we need a SOP and show how each step within the SOP was applied by the intern. The evaluation, I learned how to accurately apply workplace policies relevant to the task or current practice. I've subsequently managed cold chain medication from receiving them to packing them in the fridge. I have subsequently managed to capture stock on the real-time system after ordering the stock the previous week. I have also subsequently learned about the CCMDD program via SOPs on how to receive a parcel into the system, how to issue the parcel or mark it as collected, as the system indicates for patients, guardians, or partners in some cases, and what to ask for from a patient. I am more aware of handling stock policies and SOPs I have subsequently managed to control the fridge temperature monitoring. I would like to improve my knowledge in managerial areas such as HR policies, and I am more confident to volunteer to participate in dealing with deliveries than before. So what was the comment? It does not meet the requirements. The evaluation doesn't describe general principles rather than specific knowledge or skills acquired. And because no policy and SOP was applied in the evidence, the intended outcome of the entry has not been met. Once a coherent activity with a specific policy and a specific SOP have been completed and evidenced, and you state specifically what you learned about this, about applying a policy and a SOP, how this has influenced your practice with a concrete example, and a future learning need aligned to the domain and the skills, then only can your evaluation text be assessed. So you can see there were no clear evidence, there were no application, we didn't have a SOP, there was no policy. So this activity was therefore not successful and had to be resubmitted. Okay, so that was 4.6. Are there any questions about this activity?
Thanks, Adele. There are a couple of questions. Is it a must that evidence must be handwritten specifically for planning?
Natalie, I'm not quite sure the question because the planning section is typed onto the system. Annotations may be typed or handwritten. So maybe my colleagues can assist. I'm not quite sure what the intern is asking.
Yeah, it's not clear, but everything is sent via platform. But on the evidence, sometimes we see interns annotating using handwriting, which is not what we are encouraging, because we encourage them to clearly annotate, maybe by typing it, pointing to where the evidence is, rather than putting under handwriting, because sometimes handwriting is not clear to read for the assessors.
Are electronic signatures from both my tutor and I acceptable for the bottom of each page of the document?
Thank you, Natalie. Yes, it is acceptable, although, yeah, it's acceptable. You can do an electronic signature. That's fine.
There's a comment from YouTube. Dear all, we need to be honest about how the marking of these CPDs are done. Assessors cannot be marking on different standards. It's not fair. We all need to be held at the same standards.
Thank you for the comment. We are really trying our best to be fair and consistent when we assess. Every year, more than once, we have an assessor and moderator meeting where we discuss how we should assess. We have platforms where we can ask if we are not sure about how to deal with a specific activity. And then that is why there's also the moderation step, so that moderators can see if the assessors is consistent or within the assessments. So yes, we try to be consistent throughout. But even an assessor can even ask council that a specific activity is sent for moderation. But we are all human. So I'm going to admit that sometimes there is something that happened, and we might feel different about a specific aspect. But as far as possible, we are trying to be consistent and we are trying to be fair, and we use the assessment criteria to make sure that we are fair and that we assess according to the same standards. I'm not sure if any of the other colleagues online would like to add something. Thank you.
think you have covered Rihanna, because we are also, I mean, as much as so basically we try to be consistent, and we have criteria, the same criteria that they have on the tutor manual. We are also guided by those criteria in assessing their portfolios.
Mm.
That's all for now. I think we can move on to the next case study.
Okay, so case study number 5 is from domain 1, public health, and we're going to look at competency 1.1, promotion of health and wellness. And it's just important to look to that definition on this slide about what is health promotion. It's the process of enabling people to increase control over and to improve their own health. So that is what health promotion is, and we must keep that in mind. Also noticing that this domain is public health, so we need to address the larger public. Okay, so let's look at this case, and we look at the reflection title, conducting a public health campaign on vaccines at a specific hospital. So during my internship at this hospital, I observed that many patients were unaware of the importance of vaccinations in preventing serious illnesses. One patient believed vaccines were only for children, highlighting a significant need in public education on immunization for all age groups. Additionally, I noticed frequent prescriptions for preventable diseases, reinforcing the need for proactive healthcare. Recognizing this gap, I took the initiative to initiate a vaccination awareness campaign within the hospital. I hope that by providing accurate information, addressing misconceptions, and promoting vaccine adherence, this empowers individuals to take charge of their health. I see it as my duty to educate the community on disease prevention strategies, including the role of vaccines. Through this, I aim to learn to enhance my ability to educate the public, promote disease prevention, and build confidence in providing health-related information. Okay, so again, we must just quickly think back to the assessment criteria. What do we want to see in the reflection with the learning need? We want to see a trigger scenario. We want to see a learning need, and we want to see what I hope to achieve. And with the title, we want to see that it is descriptive and that it's original and that it is not a copy of the competency standard. So let's look at the comments. So the learning title was requirement met because the title is original and descriptive. And for the learning need, it was partially met because the learning trigger is present, but the learning need is framed too narrowly around vaccine awareness and around what you did rather than what you hope to learn. Remember, as we said previously, your learning need should not just focus on, in this case, like vaccines, but on the competency standard that you are busy with. State the general learning need that relates to the competency standard and its behavioral statements, and that could be applied across any health promotion activity, and clearly identify the knowledge or skills you need to improve. And then important to note that Domain 1 emphasizes the promotion of community health and the provision of information and advice to communities, not to individual patients or small groups. Elaborate on how your learning needs align with behavioral statements. So this is some of the comments that were provided. So let's move on to the planning. I will seek approval from my supervisor to conduct a vaccination awareness campaign focused on educating patients about the importance of vaccines, encouraging their use, and addressing misconceptions. To ensure accuracy, I will refer to the Standard Treatment Guidelines in Essential Medicines List, Chapter 22, pages 451 to 455 for vaccine schedules, the National Immunization Guidelines 2023, Section 4, pages 32 to 40 for disease prevention recommendations, and the CDC and WHO for vaccine safety, efficacy, and benefits and healthy lifestyle habits. I will design an educational pamphlet covering the role of vaccines in preventing infectious diseases, Behavioral Statement 1.1b, common vaccine preventable diseases, also for behavioral statement 1.1b, vaccine schedules and eligibility by age for behavioral statement 1.1a, healthy lifestyle habits to support immunity and overall wellness, behavioral statement 1.1c. And additionally, I will create posters for hospital areas to maximize outreach. That's linked to behavioral statement 1.1d, and develop a feedback form to assess patient understanding post-intervention, and then they link it to A2D. So let's look at the comments. So here it was assessed as the requirement is partially met. So the plan is in the future tense, and it lists the resources, but it lacks sufficient detail to demonstrate that the public health campaign can be delivered successfully. Another comment, add the specifics of the activity. When will it happen? Where will the campaign take place? Who's the target audience? And why the topic is suitable for them? How and on what will you present? Where will the posters be placed? And why those areas are appropriate to whom the pamphlets will be distributed? You should also explain how you will verify that you have reached a sufficient number of members of the public. And for each resource, you need to give the full reference and the reason for its use, and ensure that your planning is sufficient to achieve at least 75% of the behavioral statements. So let's look at the implementation. So what the intern actually did, I researched and gathered evidence-based information to ensure my vaccination pamphlet and posters were informative. Evidence 126, behavioral statement 1.1a2d. Once satisfied with the accuracy, I designed and compiled the pamphlet, evidence 9, and the posters, evidence 7 and 8, incorporating key details on vaccine preventable diseases, schedules, and the importance of immunization. And again, it's linked to A to D. After obtaining my supervisor's approval, I conducted a vaccine awareness campaign at a specific hospital. It referred to evidence 11, and it's linked to A and D. On 14 February 2025, I presented to patients, explained vaccine importance, addressed concerns, promoted adherence, and distributed pamphlets. Again, linked to all 4 behavioral statements. Posters in high traffic areas reinforced key messages. That is linked to A and D. To evaluate effectiveness, I distributed feedback forms to assess patient understanding. Responses showed how many gained new knowledge on vaccine preventable diseases and the importance of adherence. Evidence 13, and again, behavioral statements A, B, C, and D. Okay, so now we look at the evidence. So we have the websites, we have a poster, we have another information there on vaccines. You can see the annotations typed out in red and linked to the behavioral statements. If we look at the next, we can see that another website. I think this is the CDC's website, if I'm not mistaken. It's a bit small. But again, annotations. On the second one, you can see there was a piece that was highlighted in yellow and specifically annotated, and that is how it should be done, so that we can clearly see how you have used this. Okay. Then another page from a website with information on vaccinations and the reasons why kids should be vaccinated. Then we have the EDL or the EML, the essential medicines list with the vaccination schedule. So we have seen a lot of resources, but we have not yet seen the campaign. And then some more resources and the CDC website with sections there. And then we have looks like a pamphlet where they have the benefits of immunization, and then also about vaccinations. with a lot of evidence there on. Then the importance of vaccination. So these are now the posters that were placed in the hospital. But again, as you can see, we need to know specifically which section on the poster addresses A, what section represents or addresses B, what section addresses C. So that is often we get a poster like the one on the left-hand side, and it will be annotated. This is the poster that I created, and then it's linked to A, B, C, and D without stating this part is disease prevention and control. This part is healthy lifestyle. So you need to be specific to which part of your poster or your pamphlet addresses which behavioral statement. And then we have the letter, the approval letter, and then we have the photos on the right-hand side of the intern presenting to the patients waiting in the hospital or at the OPD, and then we have some questionnaires that the patients or the participants answered, and then there is no attendance register, I see. Okay, so let's look at the comments. So in this case, it was assessed to be partially met. And then the comments was that the intern need to describe the activity in full. To whom did you present? Where did the presentation take place? Where were the posters placed? What did the presentation consist of? And if it extended beyond the pamphlet content. So did you tell them that you gave them more information when you presented to them? What questions or concerns did patients raise? Which resources did you use? And then clearly state which legislation relates to a public health campaign conducted by an intern. The evidence was assessed to be not yet met because the evidence does not yet demonstrate that at least 75% of the behavioral statements were performed and that enough members of the public were reached. The references are aids only and are not accepted as actual evidence, and we have spoken about this. So you can say you use this resource to get information that you will use to address A or B or C or D, but then you will still need to show us how you have used that information and how you have provided the information. Properly headed attendance register is required, 2 feedback forms, and an affidavit are insufficient to show the reach of the campaign. You must submit the actual presentation itself. Your own, if you compile your own posters and pamphlets, it should have your name and the date on, and also the references that you used. The pamphlet uses technical terms, and a lot of people don't know what is meningococcal, what is papillomavirus. So it should be made more accessible and more on the level of the layperson, that so that everyone can understand. Some parts are not legible. In other words, it's not there to read. You need to provide evidence of poster placement. The poster shown is small and illegible alongside other prominent posters. So you put up the poster, but it's very small to see and doesn't catch the eye. And a single clear plain language poster may be more effective. So these are some of the comments that assessors and moderators made. So let's continue. You need to make sure that correct factual points are raised. For example, influenza is not fully preventable by vaccination. Confirm current vaccine availability, and consider addressing vaccine hesitancy. We know a lot of people is hesitant to get vaccinated. So that should also be addressed. And then per behavioral statement, you should explain what vaccines are and contain to support health promotion and counter hesitancy. For B, you should give more detail on disease prevention through vaccination and lifestyle and on the preventable diseases themselves. C, you should actively guide attendees to healthy lifestyle and other prevention messaging. For example, hand hygiene, use of a mask if they are sick or if they are living or sharing a house with someone with a preventable disease such as flu or COVID or pneumonia or whatever the case might be. And not only via a separate poster. And then for behavioral statement D, participate in public health campaign. You must demonstrate genuine public engagement across cohesive, mutually supporting media like posters or pamphlets, reaching a verifiable, suitable audience. And usually for 1.1, if you're not successful, a new implementation description and portfolio will need to be submitted because the entry cannot be corrected with the current evidence. Otherwise, again, it can happen that you might fabricate evidence. Then the evaluation step. Participating in this campaign was an enriching experience that reinforced the importance of public health education. By designing an informative pamphlet and engaging with patients, I addressed misconceptions, promoted vaccine adherence, and empowered individuals to make informed health decisions. This experience strengthened my communication skills, enhanced my ability to educate the public, and deepened my understanding of pharmacists' role in health promotion. The campaign was successful as more patients were now coming in for immunization. Inspired by this, I've contributed to discussions on other public health initiatives at the hospital, including TB awareness. Moving forward, I aim to improve my ability to create engaging educational materials and to incorporate interactive elements such as Q&A sessions. By continuously refining my health promotion efforts, I'm confident in my ability to enhance vaccination uptake and overall public awareness. So for the evaluation, it was assessed that the requirement was met, but the comments that were made was that the impact on your practice and an example of application are clear. And to strengthen this entry, make each of the 4 evaluation points speak to what you learn about the competency standard, which is promotion of health and wellness and its behavioral statements, rather than about the campaign topic, and focus what you learned rather than what you did. So what did you learn from promotion of health and wellness, and not just from vaccination and immunization? Provide specific details of how you have subsequently applied the acquired knowledge and identify a clearer future learning need that relates to the domain or the competency standard rather than to the specific activity. So we don't want to see that you want to conduct another campaign on the promotion of health and wellness for hypertensive patients, because then it means you have not met the outcome of the activity. So it must not be the same as as what you did, providing of promotion of health and wellness, while your example should be, I was able to participate or host a public health campaign on for the prevention of waterborne diseases or whatever the case might be. So it should be specific. And that is the story for case study number 5. And if you have any questions, we will be taking them now.
What could be the reason when a CPD moves from submitted for compliance to awaiting submission?
Okay, thanks, Nat. So when the CPDs or the portfolio of evidence entries, after they have been assessed and moderated, they will have a status of await, submitted for compliance. So meaning the results are not yet released. So whether the entry is successful or unsuccessful, they will all have the same status submitted for compliance. So once the results are released and the intern opens that entry to see whether they are successful or unsuccessful, in case the intern is successful, the status will remain the same as submitted for compliance. And when the intern is unsuccessful, the status will change to awaiting submission, meaning now the entry is open for the intern to make necessary changes in line with the assessor's comment and to submit the entry for verification by the tutor. So this is one of the common queries that we are receiving in the office, where the intern will be saying, I checked my results and the status was submitted for compliance, but after 2 days it has changed to awaiting submission. So the interns must always remember that when results are released and the status is submitted for compliance, they must click on that particular entry so that they can see whether they are successful or unsuccessful. And then they will see the changes in the status as well. Thank you.
For this competency, the SOP on receiving in my institution is divided as per the type of contract, i.e. DDV, cold chain, and direct purchase. My assessor says I must receive all of them to pass.
Lynette, could you please repeat the question? Thank you.
For this competency, the SOP on receiving in my institution is divided as per the type of contract, i.e. DDV, cold chain, and direct purchase. My assessor says I must receive all of them to pass. I received all, and they say I must now show pictures for each step of the SOP. At this point, I'm confused on what's really needed.
Okay, thank you, Natalie. So if you do 4.6 and you want to show us that you can apply an SOP, it means that you need to show that you have applied all the steps in the SOP, and not just a part. Say, for example, step 8 to 14. But you need to show application of the complete SOP. So you need to have the SOP, and then you need to have supporting evidence to show that you have applied, and you have to cross-link that evidence that you have. So, for example, it was like in this case, receiving of stock, and you are busy with the DDV, then you have the section of the DDVs. You have the complete SOP, and then the section where they have the steps in receiving the DDV stock, you will say I refer to photos, or I've referred to evidence number this, and then in that evidence where you have, say, for example, the invoice and checking that that truck was locked properly, etc. There you link it to, this is step 1, this one is step 2 of that part of the SOP. So that is how you need to do it. So you need to show us how you have applied the complete SOP. Not sure if one of my colleagues want to add.
Yeah, I think you have covered them. Maybe just to add, normally if the SOP is about receiving and it lists all the steps, obviously when you apply the SOP, you need to apply the whole of the SOP, not part of it. Thank you.
Is the acknowledgement from the supervising pharmacist enough as evidence for supervision rather than signing all the pages of the evidence?
I think we have said this earlier on to say that the evidence that are submitted should be sufficient to prove that the BS has been met. So in cases where, in this case, I think more information will be needed to back up. Like I think we said, a combination of this will be needed so that from our side, then we need to see sufficient evidence for us to be able to say they have met the BS.
Natalie, I would like to add to that one. The tutor verifies online, but the supervising pharmacist, as Rianda said, if it's a stepwise process, that the pharmacist should supervise, then they should sign all the steps or all the pages. If they just want to state that they supervise the activity, they can only provide a declaration and one signature, for example. But if it was, as Rianda said, stepwise, then they should need to sign more times. If it was just this happened under my supervision, then once would be sufficient.
If my title was vague and my evaluation didn't show application, can I correct these sections and resubmit the same entry if other sections were accepted?
I will answer this one. If it was the only comment and you were successful, then you were successful. Then you don't need to resubmit anything. And usually, if your title is not successful and your evaluation is not successful, but the rest you have requirement met, then you will be successful. So yeah, it depends on if this was the only comments and the rest was successful. But then you don't need to resubmit if you were successful. Thank you.
Is there a reason why when we submit our CPDs, each one can show submission counts of 2, even though you submitted once? And does that not lead us to paying for exceeding 9 submissions, even though an intern submitted less than 9 times?
Okay, thank you, Nate. So what is happening is when you're submitting a portfolio of evidence entry for the first time, the submission count should be 1. So if you're receiving or you're seeing a submission count of 2, then that is an error, and we will notify our IT so that they can check the submission counts for all interns in case that error is affecting a number of interns, and then that will be resolved. It should be 1 if you're submitting for the first time. So we will check from the office and rectify that error. Thank you.
Thanks, Tabang. Just to add to that, I think if you have only submitted 1 CPD and you are seeing 2, please contact the office and give us your P number so that we can assist. Does an HIV testing station qualify for a public health campaign?
Natalie, I'll maybe start with that. That can be part of the evidence, but if you look at the behavioral statements, there's disease prevention, healthy lifestyle, so that can be part of the campaign, but they will have to include additional evidence to address all the behavioral statements.
Can we present to multiple groups to show that it is a campaign for the community rather than a small group? Trying to understand how to show this in light of the examples comment.
Um, thank you, Natalie, and thank you to the for the comment, the question. If it is a health campaign, then usually a proper health campaign is conducted over multiple days. It's not usually not just once off, although we accept it. But if your campaign, it depends on the number of how big is the small group. If it's just 2 people or 1 person or 3 or 4. But if you do it at the OPD and there's 10 patients and an hour later there's 10 other people, and then again so you do it continuously, you repeat the session throughout the day and you have them sign the attendance register with all the relevant detail, then I can't see that it won't be accepted, but we must see um, that it will reach the larger public and that it is relevant to the audience that sits in front of you. If you have a specific day for diabetic patient to collect their medicine and you want to do something on health promotion for diabetic patients, then you can repeat your session throughout the day if you want to get a bigger audience. Yeah, that's one idea. I don't know if someone wants to add. Maybe. Thank you.
Yeah, you're right. I think what we see mostly is when interns give evidence for 1 or 2 patients, then you ask yourself, I mean, the campaign needs actually a bigger group. So yeah, and like you gave example, maybe schools, taxi rank, even the example I was given for the HIV testing area. As long as the other BS are covered, for example, if maybe they are there and then there are patients, they're waiting to be tested, and then you can do a campaign there. So it's more of actually getting information to the public.
I find it difficult to provide all the information that evaluators are looking for with the very limited characters. How can I be more concise and still provide all the information?
Yeah, I think there was a question like this previously today that they spoke about characters. Characters, yes, I mean, it's 1,000. And if they stick to the points, then it should be able to fit like all others. I think the problem is when they add other things that are not relating to the beer. This is where now the problem starts.
How do you include a website as a resource in your planning? Do I provide the link to the website, or I can do this in my evidence?
Thank you for the question. So you can, so for example, you want to access or you want to search on the WHO's website. They usually have disease-specific pages. So you can say you're going to access the World Health Organization page on hypertension. And I will accept that because then I know it's going to be where specifically you going to look at. If you have space and you have sufficient characters, then you can add the website, the web address. We have seen interns that included the web address and they still had the characters were sufficient to provide or to explain or give the complete planning. So yes, thank you.
For 4.6, I submitted twice but keep getting comments on evaluation, specifically about another way I applied the skill. I did stock receiving and ordering and applied it by using a SOP for stock take.
Thank you for the comment. Yeah, I'm not sure. It's difficult because I don't know how you wrote up your evaluation and how you wrote up the application of what you've learned. But usually we want to see a different. Well, okay, stock receiving and ordering is a different, or stock take is a different SOP. Yeah, so I'm not sure. It's difficult for me to comment if I don't know exactly what was written there. I don't know if some of the other colleagues want to add.
Yes, Rianda, I agree. It sounds okay. But for the intern not to be successful, there should have been other issues as well. Yeah, so maybe depending on the number of times they've submitted and they've not been successful, maybe try and consult the assessors to get some guidance. But if that was the only issue, the submission would have been successful. So yes, it is difficult without seeing the whole submission.
Can I use a prescription that was signed by another pharmacist on duty but under the supervision of my tutor?
Yes, you can. Remember that according to legislation, you need to work under supervision of a pharmacist. It's not compulsory that it should be your tutor that signed there, but you should work under supervision. Your tutor will verify online, so they will verify in any case. But yes, another pharmacist can sign the prescription that have supervised you. Yeah, thank you.
When it comes to registers for attendees of presentations, do we have to hide their names for confidentiality?
Natalie, yes, I'll take that one. If it's patients, yes, you have to. If it's 6.2 and it's other healthcare professionals, then you don't need to, and they can provide their registration numbers as well.
For applying my SOP for handling of Schedule 6 covers dispensing, printing the register monthly, and conducting a physical count of Schedule 6 medicines. I initially applied the SOP but failed because of that.
Like we said, the SOP, if it's applied, like they've given example of Schedule 6 where there are multiple things in the balancing and so forth. So when the SOP is applied to satisfy B? Yeah, they need to make sure that everything that is on the SOP is also covered in the evidence.
Where can I find policies for domain 4.6 if my CPD is on prepacking? I have not seen any at the pharmacy and I cannot find any on the SAPC website. The only resources I managed to use for the CPD was the SOPs and the GPP, and my CPD was returned for using those.
Okay.
Okay. Then go on.
Okay, thank you for that question. You don't need to, if you do pre-packing SOP, then your policy doesn't need to be pre-packing. You can do a different policy. And in the intern manual, I think it is page 40, I'm not sure if I'm correct, but there's a list of examples of policies that can be used. So it's not necessarily that it needs to be the policy that fit to the SOP. It can be something else. That's why we said it can be two different triggers. That was one of the questions earlier as well. Thank you.
Yeah, the page is, I think this yes manual is page 40. That is where they list all the examples of the policies. And if, for example, the intern want to do policy, it has to be a policy, because if there's no policy that they can find for pre-packing, for example, then they should look for any other activity where they can use other policies which are available, disposal policy, infection policy. So there are a couple of them on page 14.
For a public health campaign, is it fine that I run the campaign aimed at the hospital staff, including admin staff, cleaners, porters, stock controllers, nursing staff, etc.?
Okay. Okay.
Yes, Makodo, you can continue.
I wanted to say, anyway, as much as in some cases we do accept, but the public campaign, colleagues, is getting information to the public. But yeah, we do accept when interns do that part of campaign in the hospital. But ideally, I think the patients will be the good example. And like I've said before, maybe going to the school, going to whatever takes rank, to the malls. Yes, sometimes they do that, but I go for the best.
About competency standard 4.6. I plan to do a CPD about the application of the SOP and policy for the crediting of medication previously dispensed to hospital inpatients, handling of medication returned from wards. However, the recent amendment of the rules for the good pharmacy practice has that mandatory SOP for an institutional pharmacy removed. Can I still apply this SOP?
Natalie, I'll take one. Yes, you can apply the SOP. You're not bound to the mandatory ones. If you have additional SOPs in your facility, you can apply that. That'll be perfectly fine.
For this example of the health campaign, what will make the resources, for example, the website, credible? If no resources were used, hence not adding it to the evidence, and the focus is purely on the activity, will it discredit the evidence?
I'm not sure if I understand the question correctly, but I'm going to try. So you need to provide resources. You cannot submit or complete an activity successful if you don't have resources that you're going to use. I mean, you will need to look at certain resources that you will use to, for example, check the validity and authenticity of a prescription. Or you will need to have resources that can help you with uh, compounding. You will need the GPP as a resource. So you cannot submit a successful activity without including resources. The resources is very important to add. So you will need to include the resources. I'm not sure if I understood correct. Maybe one of my colleagues can add.
Yeah, quickly maybe. Yeah. For example, for health promotion, like Arianda said, um, uh, we need the resources. For example, under health promotion, you can go to WHO. They'll talk about that. When you present a poster about healthy lifestyle and prevention, that poster, that information will be coming from somewhere else. So that is where you put the reference to say, I've used this particular reference to get information to design my poster. That is how you can do that.
Thank you. We are running out of time, so we're going to do two last questions. Can I do an online campaign for the general public for 1.1?
Natalie, Sorry, Rianda.
No, no,
I'll maybe-
Adele, go.
I'll maybe start with that one. It might be possible, but I do see a bit of a few red flags. First of all, how do you going to determine the audience and determine that the information you're going to provide is relevant or important to that audience? That's the first thing. The second thing is, how are you going to determine the impact of your campaign or get your questions? Maybe the intern has another idea, but it might be possible, but I do see a few issues with that. Brianda, maybe you can add to, or I don't know, what do you think?
No, no, I agree with what you said. How are you going to prove that your campaign was successful and that you have met met the public and reached the public who this was intended for and how they perceive the information? So I would not attempt an online campaign.
Last question. For domain 6.5, critical analysis, is it okay if the article I am appraising is from 2 years back?
Okay, let me take this one. Yeah, I think what is important is the point or the resource where you get the information to from that you will use to for your CPT. 2 years back, I think it is still valid, but colleagues can also add.
I'm just quickly want to look at the behavioral statements of 6.5. Critically evaluating literature in the context of the practice of pharmacy and education. Sure. Firstly, one article will not be sufficient. So you will need to have multiple articles. And it will depend also on the context of why you want to do the critical analysis. What was your trigger and what is your learning need? Adele, I don't know if you want to add.
Yeah, the intern must remember that we identified this as not a recommended activity. I don't know if the intern is maybe an academic intern, that it's part of their research, but I would be careful, depending on what their situation is, for doing a critical analysis. And as you said, it's not just only one article. It's they have to examine the literature, and it's not merely evaluating the one article. They have to make a deeper insight and provide some judgments about this. So depending on their situation, I would be careful for this, except if they're an academic intern and it's part of their research activities. I would be very, very cautious.
Yes, I agree with that. I would also not select this one. From domain 6, there are other competency standards that is much more doable and suitable for an intern to do. Thank you.
Thank you, everyone. That's the end of the questions. The register and attendance register and survey link and QR code is currently on the screen. Please, will you scan the code or click on the link that has been provided in the comment section? There is an opportunity for you to ask any further questions in the survey. Thank you very much.
Good evening. I think we've come to the end of the session and would like to just communicate a way forward from the Office of the Registrar, which includes information for our interns regarding just some areas where they need to be on the lookout for, which is ensuring that entries submitted are checked against the assessment criteria that has been spoken about much of this evening, which is outlined in the portfolio of evidence guidelines on the pages 35 and 36 of the 2026 published intern tutor manual, which we believe you have now really come to be familiar with and familiar with. Another way forward item is just to make sure that when resubmissions are done, that you carefully consider the comments that are made. And we've been hearing the rest of the evening what seems to appear as the assessor's outcome. It is not the assessors it's not the assessment outcome of the assessor. It is actually the outcome of the assessment, which would have been part of the moderation as some of the facilitators spoke about. So please do take it in kindness that the assessor is not trying to attack you. And the whole objective of this is for you to become well equipped, for the future that lies very close ahead of you. When you get roles such as RPs and all of that, which speaks to the main objective of council, which is to protect the public. So it's not a personal attack. Look forward to correcting and follow all the other processes that council communicates with you in terms of getting assistance. And I think Natalie has covered the slide for attendance, which is a requirement and a humble request for all tutors that are attending today as well as interns. Because that then feeds back to council as to how the workshop went. And the last thing from the office is just to continue to be on the lookout for our fourth National Pharmacy Conference that's happening at the beginning of October, and that we're excited. So also you would have seen on platforms like the WhatsApp channel, there are nominations for awards, and the closing date is the 30th of June 2026. So please do submit your nominations for the National Pioneer Pharmacy Awards. And I think without wasting any more time, we'd like to thank the team of facilitators that joined you today with their excellent expertise to further guide you. We'd also just like to appreciate our communications department that makes this possible, as well as the team within CPD and registration, and alongside the support from councillors as well as the Office of the Registrar. And we wish you all the very best. Do get in touch for any further assistance that you may seek. It is a good night from us. Thank you.
Good night, everyone.
Thank you. Bye.
Night, everyone.
Good night. Thank you.